Hi, everybody. Back again here, Marty Conroy. Going to tell you about, Lou got us going here. He got us all excited. Now, where do we go from here? And how can you help us reach our joint goals? As Lou mentioned, we've been doing a lot of work, the Language Line folks and the IMIA folks in Washington advocating on behalf of interpreters and patients. Still a lot more to go. A lot of things going on. This is who we're working with. Our partners are Cardinal Point Partners. It's a lobbying firm. I'm just going to flip through this because I know we're going to be running late here, so I'm going to keep moving along. But it's a lobbying firm that's focused on government relations. They're originally based here in Boston, but they were located about a couple blocks from the Capitol. So we've been spending a lot of time down there working with them. These are the folks that we've been working with, the principals and the vice presidents of Cardinal Point. And as Lou mentioned, these are the various committees we've been to. And Kate Auspitz said this morning that Congressman Capuano gets it, and he absolutely does. And there are a lot of congressmen and senators that get it, but there's just as many that don't get it. And as we move forward with health care reform, is there going to be health care reform? Is there not? Is there going to be a public plan? Is there not? What's going to happen? We need your help. We need your help now. We need your help in May 1st, April 30th. We need your help going forward. Because right now, again, I'm flashing, these are some of the people that we have been meeting with. But this is the what we have right now. We have two bills. We have a bill in the Senate that's coming out of Senate Finance and the Senate Help Committee. Hopefully the Senate Finance bill will be passed next Tuesday. Then over the next week or so, a Senate bill will be combined, and the U.S. Senate will vote on a bill regarding health care reform. At the same time, the House, they're working with H.R. 3200, and when Kate Auspitz mentioned sections 1221 and 1222, she was absolutely correct. That's the areas that we're certainly concentrating on. Because in this, I don't know, 700-page or 900-page, whatever it is, bill, there's a couple sections. Right now, those sections are only in the House bill. They're not in the Senate bill. The House has provisions within the bill that calls for a study and demonstration for reimbursement for the Medicare program. Right now, Medicare doesn't pay a dime for language assistance. So there's a study and demonstration called for Medicare. And that bill also calls about the federal match for Medicaid. Right now, the federal match is depending on what the state's federal share is. It's usually around 50%. They're going to up that, if the House gets their way, they're going to up that to 75%. So it'll encourage state legislatures to start reimbursing for Medicaid. Now there's only 13, 14 states that reimburse for Medicaid for language assistance. So if we get our way, if the House bill passes and it becomes part of the health care reform law, we will have reimbursement. We'll be on the road to reimbursement. But how does it work out? What happens is the House will pass a bill and the Senate will pass a bill. The House bill will probably be toward the end of October, be passed. The Senate bill will probably be in the next week and a half. Then they go into conference committee, where they take the two versions of the bill and decide what's going to be the final bill that would be passed by both houses and put before the president for signature. Right now, if the Senate bill prevails, there will be no reimbursement. If the provisions in the House bill prevail, there will be reimbursement on a study and demonstration project for Medicare and an increased federal match for Medicaid. What are we talking about? We're saying to them, focus on credentialed medical interpreters. Everybody here is trying to figure out ways to cut down the cost of this bill. And they're going to be sitting in committees and they're going to be trying to dissect this left and right. There'll be a lot of calls for anything that costs more money to be left out of the bill. We have to ensure that the provisions that provide for reimbursement for credentialed medical interpreters for both Medicare on a study basis and Medicaid at an increased federal match still remain. So what do we do? We've did a lot of outreach to the Congress, a lot of outreach to the administration, a lot of folks here that we see and will continue to see. But what are our next steps? We have to continue to educate the leadership. Again, Congressman Capuano gets it. Others we still have to inform, educate. What's going to happen here is in the next couple of weeks, say around the 27th of October, there'll be a Senate bill. It'll be passed. It'll be known. About that same time or maybe a week or so later, the House bill will pass. They will then start the conference process. We have to reach out. We have to call on you folks to advocate on our behalf and on your own behalf, to reach out to your legislators, your congressmen and your senators, that once those two bills are passed, we can have some assessment as to what made it through, whether the reimbursement made it through or not. But it'll all depend on that conference committee. At that point, which is right around Halloween, we're going to have the wonderful task of reaching out to senators and congressmen to make sure those provisions that are in the House bill stay in the final bill that's presented to the president. At that point, we will let you know where we are. We will ask you, we'll send out some email blasts through the IMIA to make sure that you get out there and help us reach out to your senators, to your congressmen, to insist that we have credentialed medical interpreters recognized within the healthcare reform bill, and that Medicare and Medicaid make available reimbursement. That's the end of my presentation. I'm now going to turn over to John Weiner, who's going to talk about the statistical analysis that took place for the test. But please reach out for us come Halloween to make sure we get reimbursement in the final healthcare reform bill. Thank you.